So again, welcome everyone. My name is Daniel Tan, licensed clinical social worker with the Community Technical Assistance Center at NYU's McSilver Institute. I want to welcome you to today's Mental Health Moment event, a conversation about ableism and neurodiversity, diversity and inclusion in mental health. Before we get started, I just want to take a moment to orient everyone so you know how to participate in today's event. So please note that upon joining the webinar, you have been placed on mute to avoid any background noises that may distract from others listening to the presentation. If you come across any technical issues during today's event, please make sure to just chat to the hosts who will be able to assist you. Our wonderful CTAC admin today is named Kiara. We would also appreciate if you could take a moment to fill out the brief feedback survey that will appear on your screen after you close out of the webinar. And also let us know if you have any suggestions or topics you'd like us to cover. The recording and slides for this presentation will be posted on our website, ctechny.org, in the next couple of weeks, along with a tip sheet that we will develop after having this conversation today. And as a reminder to everyone, this is a two-part event. By signing up for today's event, you are auto-registered for part 2, which is next month. So honoring neurodiversity and addressing issues of ableism are becoming increasingly important as we continue to really support access and equity in all spaces of mental wellness. We want to have a mental health moment with our guest, Emma Arnoff, to engage in dialogue and really gain further perspectives about tackling ableism in order to promote neurodiversity and ultimately to support youth and families within New York State and beyond. Our conversation today will focus on the basics of neurodiversity, ableism, and sensory integration, include stories from Emma about how she has really learned from neurodivergent youth and their families to highlight the importance of doing that learning from piece. And we'll showcase a brief introduction to the idea of creating neurodiversity affirming spaces. It will be a conversation to offer some breadth and basics, while part 2 will build upon what Emma will be sharing today. It will also offer continuing education credits for those who need them and will be more interactive and offer more depth to enhance your practice next month. At the end of our conversation, you will have the opportunity to submit questions for the Q&A portion of today's presentation by utilizing the chat box feature. You can click on the dialog bubble on the toolbar at the bottom of your screen to open the chat feature in order to ensure that we are able to answer as many questions as time permits. You're requesting that you send in your questions at any point during the webinar. We will collect them and address them during this Q&A portion. Laura, I see you in the chat box. Yes, the recording will be available within the next couple of weeks. With that being said, I'm just going to welcome Emma Arnoff. She's a licensed clinical social worker and the proud owner and director of the Sensory Space in Poughkeepsie, New York. She leads a team of 12 clinicians and works with children, adults, families, and groups in the sensory space, where youth are able to use sensory supports for participating in play therapy and other psychotherapy approaches. Emma leads workshops for clinicians, schools, parents, and universities. Workshops focus on supporting neurodiversity in families, schools, and organizations. So everyone, please welcome Emma.
Hello, hi everybody.
Welcome. So I'm just gonna stop sharing the screen now. Let's just really get right into it. Let's define neurodiversity. Can you tell us what it is?
Absolutely. So neurodiversity, the technical term, is broadly defined as an approach to learning and disability that suggests diverse neurological conditions appear as a result of normal variations in the human genome. So what that means is that all brains are different, but no brains are deficient or wrong or in need of fixing. All brains operate differently, see the world differently, and learn about the world differently.
Thank you. So, I do want to first ask, actually, where does your passion for neurodiversity affirming work come from? Tell us a little bit more about that as we begin our conversation today.
Absolutely. No, that's my favorite part of the story of how I came to be sitting here in front of all of you. I've been a therapist for quite some time. I've worked with neurodivergent children in the past, even though we didn't always have that language when we spoke about those children and families. But for me, the real turning point was in my experience with my own son. He was in preschool, and we were struggling because he didn't want to do certain things like touch the rope at school. He didn't like loud noises. He didn't like being around large groups of children. Very difficult to get him to eat. Textures were really challenging for him. And his teacher and I spoke about it. And rather than seeing it as some kind of defiance or he wasn't doing what he was supposed to, we could see he was wanting to, but his, was challenged in his ability to do so. And I had him go through early intervention, and he received occupational therapy. And that was where I started to really get my own in-depth lessons on sensory integration, on using tools to teach to meet sensory needs for my son. And in that process, I really saw that his anxiety decreased when he was able to better take in sensory stimulation around him. And that really inspired me to want more of that for my community. And I looked around after he had gotten a little bit older, and I didn't have anywhere to go next. I wanted more services. I wanted, him to have something else. And so the sensory space was born out of a need that I saw in our community. And the more I've done this work of integrating, sensory-based work with emotional-based work, I've realized so much from the people I'm working with here, which is children all the way up to young adults, about the power of creating a neurodiversity affirming space, a space where everyone can walk in and feel welcome here and feel served, whether that means, therapy feels better on a swing than it does in a chair, or climbing or throwing or in movement or on a trampoline. And so, the sensory space was born. We now have 2 locations, and I'm anticipating more to come because this has become such a growing need in my community, but everywhere.
Thank you so much for really sharing personally what really promoted your own journey into really wanting to create neurodiversity affirming spaces. And you have started to talk also about this idea of sensory integration. Can you talk more then about your experiences working with neurodivergent youth and families, and how your approach of incorporating sensory integration can be helpful, or even maybe define that term a little bit as well?
So sensory integration is basically the process of the brain taking in sensory stimulation and creating, appropriate responses. And for some of us, that comes, more natural than others, right? So someone who has a heightened sense of smell, or someone who has a heightened sense of hearing, is going to have a harder time being in a loud room, or being, I had a client, I remember still, she didn't come to session because her mom spilled gas on the car, pumping gas, and it was just too much. And I said, please, that is not worth coming to, session that day. That was overstimulation. It wasn't processing through as need be. And, for us, what we really believe is that you can't really separate emotional regulation from sensory integration. So, you can see behind me are just little tools around my office. That's a weighted animal that sits on my couch. But in our big playroom, we have the swing, the climbing area, sensory bins, all different tools that children are able to use in their sessions. Kids, a lot of kids we work with do a lot better in motion than when they are still. Those are, what we'll call sensory seekers, which you'll learn more about in part 2 of my seminar. But those, we have some kids who are running into the wall every few seconds. We have some kids who need a spin on the swing because they need more stimulation. And through that work, mixed with play, mixed with, emotional tools, they're able to really feel comfortable in the space and regulated, and then do the work that is therapy.
Thank you so much for really sharing that. And I did want to actually just highlight the picture that you sent us. to really, can everyone see this, right? To give a sense of some of the aspects. And I don't know if Emma, you want to just describe a little bit about this image to further, hone in on what you just said.
Yeah. You're missing certain things that are really great in that picture. But you can see our yoga ball, you can see our dollhouse, our kitchen. We're all play therapists at the sensory space. So that's a large part of what we do. In the part 2 of the seminar, I'll talk about play therapy, which is the kind of play therapy we do that is designed for neurodivergent youth. But, also, we have all the play therapy tools, but we also have a climbing tower, and we have a crash pad, and we have a trampoline, and there's just a lot of room for different kinds of movement. When I teach at schools about neurodiversity affirming communities, something we explain is, it's not, the idea is not to create accommodations for neurodivergent children. It's to create communities that everyone thrives. And ultimately, by putting tools in that benefit neurodivergent children, we benefit everybody. Like, you'll find my staff in that big room on the swing between meetings to regulate their system. So when we create environments that are neurodiversity affirming, we really create environments that are better for everyone.
And you're creating those environments by really learning from the people you work with and from your own family. Why is it so important to really think about that? Why is it so important to think about learning from the people you're working with who are neurodivergent?
Yeah, one of the things I'll talk more about in part 2, but I'll begin a little bit today, is the difference between acceptance and awareness. I learned this a couple years ago when Autism Awareness Month was happening, and one of my clients said to me, "I don't like that. It needs to be acceptance." And she explained to me, "I don't need people to be aware I exist. I know they know I'm here. I need them to accept who I am, and that means talking to me. And when I get a narrative from the people I work with, that's how I learn what people are wanting and needing and wanting to be referred to and wanting to be understood as. Um, you know, the goal of being a therapist is never to be an expert, it's always to be a learner. And I think in working with neurodivergent clients, they are my teachers. And the more, what I feel very fortunate about is I work with some neurodivergent adults. And so they really give me insight into things so that I can apply those to the children I work with that maybe the adults I worked with didn't get as children. And, things like we're really moving to using identity first language now. So when I went to school, we said person with autism, as we didn't want to define someone by that. But now people in the artistic community and other neurodivergent communities are saying, we want that as our identity. We're proud of that. And learning that from an autistic person is very powerful because it's their lived experience.
That is very, very key. And I see some people in the chat actually are really resonating with what you're saying. So, shout out to Janine and Javon, who are really highlighting this idea of like working from awareness to acceptance, and also having appreciation mixed into it as well. One of the things I'm also hearing you talk about is this idea of ableism, actually. How does this all relate to ableism? Can you maybe tell us a little bit about what that means and how it seems to relate?
Yeah, I mean, I don't think you can be neurodiversity affirming without knowing about ableism and understanding ableism. Ableism is discrimination of people based on their disabilities, and the idea that typical abilities are superior, right? So at its heart, ableism is rooted in the assumption that disabled people need to be fixed. And, a lot of approaches that we may have taken in the past or, ways we might work with children and families can be very ableist and we're unaware. And not even just in our work, but in our existence. And we really have to think about, is the goal to fix the child to make them what we expect them to be, or is the goal to create environments where they can thrive as who they are and we can learn how to better support them?
Yeah, it's really such a shift in mindset a bit. And, you know, Kate in the chat box also summarized a bit. Neurodiversity is an approach to learning that suggests that neurodiverse conditions appear because of normal variations in the human genome. All brains are different. No brains are in need of, quote, fixing. Oh, yes, verbatim note taking. Yes, we will have the recordings, everyone who's concerned, and we will be offering a tip sheet afterward. You know, one of the things actually, Emma, as I'm hearing you talk about this idea of sensory integration is also this idea of like two people talking in a room isn't for everyone. Like what, you know, I know this is kind of like a stereotype of therapy, right? Like it's just two people talking in the room. Can you share maybe a little bit more about like why that wouldn't work for everyone?
Yeah, absolutely. I mean, I don't think one size fits all therapy works for anyone. And I think particularly, you know, for neurodivergent kids and adults, it has to look different. As I'm saying that, I'm just going to add a little tangential point, which is, you know, something a lot of my adult neurodivergent clients remind me is that neurodivergency is not a disorder of childhood. And that there are, you know, autistic children grow into autistic adults. So it's important to remember whoever you're working with along that age range to be conscious of your ableism and their neurodivergence and what that looks like. But yeah, I mean, I think talk therapy isn't going to be working for someone who has communication differences or someone who can't make eye contact or is uncomfortable with eye contact. That's fine. But it's going to be really awkward if we're just sitting across the room from each other. And that's, you know, how you're supposed to understand your feelings and who you are. Whereas when your body is in motion or you are fidgeting or you're able to meet your sensory needs in other ways, it's a lot easier to connect to someone. Also, we use play therapy because, you know, not every, actually most children and people in general do not walk into the room and say, I'm here because I'm frustrated and here's why, and here's what I'm trying to cope with, right? But the way that a child can get on the floor and just be with us and the things we can learn in that experience is actually much more powerful than the forced questioning that would come from just sitting across the room and trying to, you know, pull out information. I think any parent knows what it's like when your kid gets home from school and you say, how was your day? And you get fine. You know, that's not what we're looking for.
No, no. And you know, I really appreciate the messaging that you're also pushing forward, which is that thinking about being neurodiversity affirming is something that helps not just youth, but also adults. And so all of us can really consider how neurodiversity affirming spaces impact us in helpful ways as well. And of course, I see a bunch of people putting comments in the chat box. So please continue to share your thoughts and reactions. Again, we are collecting questions that Emma will be able to answer in our Q&A section at the end. You know, and one of the things that you are also talking about is this idea that the way that we might typically conceptualize our practice, our clinical practice, is not always from a place in which we're completely aware of how neurodiversity affirming it is, or we're not aware of the way that ableism shows up. So maybe can you help us understand, well, what are ways that people can be ableist without being unaware of it, without being
Yeah.
aware?
Yeah. You know, I think as with any ism, you know, ableism, we all have it in us. We were raised in a world that is ableist in the sense that it, you know, being typical is usually valued over being divergent. And so we find ourselves doing it often unaware. And I think for me as a therapist, something I've really had to come to terms with is looking back at the way I've practiced in the past and saying, I did the best I could with what I knew, but it's important now that I know more. That, you know, I need to be different now. And it can be really hard to make that shift because we want to say, well, I knew what I was doing. I wasn't doing anything wrong in the past, but it's important we do that. You know, things like asking someone to look you in the eye. That can be very ableist, right? A lot of people either that can't do that or that feels extremely uncomfortable for them. Assuming someone who's disabled wants help with something, that can be very ableist, and that can be challenging because you also want to look kind and you want to look thoughtful, but you also want to think, I know for me, I don't always want people to help me. I want to feel empowered and I want to feel independent, and so do disabled and neurodivergent people. Dismissing an opinion from someone because they are neurodivergent, assuming they don't know what they're saying. That happens to neurodivergent people all the time. I see that with clients I have who say, I'm trying to tell the adults in my life or the people in my life, this thing was happening, and it's just like, well, you don't know what you're talking about because you see the world differently. And that can be really frustrating. It doesn't mean that, everything a kid says or, a teen, we say, oh, that sounds exactly right. But we say, oh, like, I really want to understand your perspective. Please share that information with me. And one thing that we were really trying to be more conscious of here is talking about a neurodivergent child or person in front of them as if, they're not there in the room. Often a parent might engage me while their child's there and they'll start talking about something that's going on with them. And I'll say, let's chat about this later, because we need to have a conversation, but we don't want to make the child feel like they're not a person who can hear and is present and aware of what's happening in this room. We really try to keep we don't do as much family sessions unless they're play sessions. When it comes to the parent work, we really try to keep that separate from the work that children are doing, because a child doesn't want to sit and hear people talk about them. And I know my, neurodivergent adults actually feel that way often in the world too, that people think that they're like childlike, or people can talk about them and they're aware of what's happening around them just like we are, and it doesn't feel good. So those are just some examples of ways that we can, all be able to, or there's things that, we don't even realize we say, like the blind leading the blind, right? Or I've heard people use mental health terms like, you're being bipolar, you're being crazy right now, right? And we don't want to use terms like mental health disorders or being blind or deaf in a joking way or in a way to describe people that are not those things.
What I'm really hearing from you a lot of is just how much your own journey consisted of really trying to understand very fully what neurodivergent youth and adults have gone through, and really, really making sure that you're not letting, as much as you can at least, internalize ableism really impact decisions you make, the way that you interact with people. And you've really then talked about this idea that, well, okay, your clients and are your best teachers. Maybe share a little bit about what you've learned about ableism from the people you've worked with, and how it's impacted their lives, if you have any stories.
Yeah, absolutely. I'll say they are definitely my best teachers. It's one thing, I'll tell you a story for sure, but one thing I really try to make sure all my clients know is that I am a constant learner in this world, and I will say things wrong, and I am imperfect. And I want them to feel like they can always teach me and correct me, because if they feel comfortable to do that, that's how I'm going to end up in a place to learn from them. I'm not the expert in the room. They are, and I'm here to support them. I have one client that pops into my head as we're talking about this, or actually two, who have really talked about their journey and how they got to where they are now. And, a lot of this one client's childhood was people telling her why her behaviors were wrong, right? About she needed to learn to sit still. It's particularly a unique experience to be an autistic girl, because there's, just certain expectations of that. She didn't want to sit still. She couldn't sit still. And that was, just such an expectation. Or people always told her she didn't know what she was talking about, or she was just being too sensitive on things throughout her life. And now as an adult, she's, saying to me, I am who I am. And all this time I have, people don't go to therapy because they're neurodivergent. That's a really important thing to understand. You don't go to being autistic, being neurodivergent, having ADHD, you know, being an ADHD, or like, that's not a reason you go to therapy. You go to therapy for the symptoms of living a life as a neurodivergent person that come from living in the world that we're in, right? So for her, she's been told she's anxious her whole life, but is she anxious? Or were people telling her she was doing everything wrong her whole life? And now she has to learn how to live in the world as she is. So, you know, that's an example. I have kids who are in school and they're told not to doodle, or they're told to be, you know, stay in their seat, or, you know, walk in the hallway from class to class in a very specific way. And that doesn't work for them. And so when I work with schools, especially, I talk about things like wobble chairs and, you know, changes to the classroom that can happen, but they need to happen for everyone. And that way we're not pointing out our neurodivergent youth and being ableist in that way.
Thank you so much for really sharing such personal stories, but also the many ways in which ableism have really come out to really not support everyone, actually, right? And part of what I heard you say earlier was some adults realized that they're neurodivergent and they didn't know about that before. And this framework actually helps them further understand how they've navigated the world. You know, one of the things I'm also thinking about then are the family members of those who are neurodivergent. What have you learned from the families then about how to support a whole family, considering how ableism has impacted all of us?
Yeah, it's a great question. And I'm going to have a whole section on working with parents in the seminar, but just a little brief intro to it. You know, they are also dealing with ableism, both internally and externally. And that's a really challenging place to be. As a parent of it, you know, I have so many parents who say, I'm trying to better understand my child, but, you know, culturally, or, you know, my mother says, just tell her what to do and she needs to just do it. And that does, you know, and so we have our family systems operating, we have our cultural systems operating. And so I really try to, the same way I would meet a child where they are, I try to meet a parent where they are. So, you know, I started talking before about identity first language, right? So that's really a move that the neurodivergent community, specifically the autistic community, but across the board, are making, to say, I'm autistic, I'm an ADHDer, as opposed to I'm a person with autism, because we are not thinking of it as disordered anymore. But often I have parents who come in and say, I have a child who may be on the spectrum, or I have a child I think may be a little autistic, right? And those are not neurodiversity affirming ways of looking at it. But I don't start with, you're wrong, you're bad, don't talk like that, because I was talking like that not that long ago. We're all still learning, and there's not always just one right way to do things. And I try really hard to be patient and understanding of what a parent is going through and understanding their unique child. Often they might find out they're also unique in understanding their unique child, right? And then giving them, you know, the tools and ability to be with who their child is. You know, our goal here is not to give parents back a different child. It's to help the whole family system work with the great child they have. And that doesn't mean that, you know, every behavior is acceptable, but it's learning to take the, you know, a child's amazing qualities and uniqueness and learn how that strengthens the whole family system.
You know, what I really appreciate this is this idea that it's not just about policing language. It's really about kind of helping people live almost in a neurodiversity affirming way, to live in an anti-ableist kind of way, which is a process. And that's why you see what you're doing is you're assessing like where people are and what they've internalized. And then you're working with the whole family slowly to really create an environment in session and within the family to really help them do well. And you've talked about how you started your own process and how to really improve on being neurodiversity affirming. What were you taught in school,
Yeah.
actually? And I don't know, where do you think that comes from?
Yeah. I mean, I think, you know, something that's so interesting. It's first of all that these, things like this, like neurodiversity, are so ever evolving, right? So what I was taught 15 years in school was you do not say autistic person. And so I've really had to work hard to change that, way of speaking in me, because I was so taught that that was, things were the opposite. But the other piece that we work with our families on is this idea of being bilingual or trilingual, if you will, in understanding the different systems that their children are in. So, yes, we're, in this progressive way of thinking, this neurodiversity affirming approach, but the medical model is not there, right? The DSM still defines autism spectrum disorder as a disorder with many deficits. If you look at the New York education models or other things and how they define disability, it's still very deficit focused to be able to receive services. So it's very important to us to explain to our families that we have to understand all the different systems we're within, even though this is the way that we want to help you live your life. And it's challenging, right? I say to my kids who I work with sometimes who are like, why don't my parents get it? Or things like that. I'm like, well, I'm still getting it. And I have, a master's in this, and I've been to all these workshops and education on this, but it's changing. And we all want to get caught up and be in the right place. But, we're not only learning, we're unlearning. So that's a process that we all have to go through in our own ways.
That unlearning piece is really, really important, because we've all been socialized to be ableist. And that has such a negative impact on those who are neurodivergent, and upon everyone, right? And so maybe you can actually tell us then what are some of the approaches or strategies that you've realized are just really not neurodiversity affirming, that are ableist, and that you've maybe shared with you, like actually it's harmful or traumatizing. So our learners could hear a little bit more specifically about some of the things that they could reflect upon.
Yeah, we're definitely moving away from this behavioral intervention model. In many of the jobs I've had when I was in school, we would call kids, these are behavioral kids. These are the acting out kids. And that is just not a language I use anymore, because behaviors don't exist on their own, right? We don't act out. We don't yell. We don't throw things. We don't do the things we do for no reason out of nowhere. And something I've really learned is when, you can reward chart or, try to change a child's behavior through, gratification and that way of being, but that actually is not getting to the root of what is this child or person in front of me suffering with? What is this? What are they trying to tell me? And so, we're really trying to get to a place where we can communicate. First you connect, then you understand, and then you create opportunities where those behaviors don't need to exist, rather than the other way around, which is, you should look at me when I'm talking to you. I'm going to give you a reward if you sit still every day. Or how about maybe your body's not meant to sit still. Like what intervention can I do? We don't want to just change behaviors. We want happy children. We want people who are living lives that they're proud of. I think that's what I've learned from a lot of my clients is, yes, I can learn to be compliant, but that is not a happy, empowering, or productive life for me.
So being ableist and really kind of those manifestations of ableism don't make for happy, empowering lives, and that's really sad to hear. I think it might also be helpful then to consider, well, how do we actually better understand our own role in ableism, and has ableism also hurt ourselves? I'm just kind of thinking about that as you talked about your own journey in understanding it.
Yeah, I think we miss things that, I'm thinking of this student I work with. She's a teenager, and she came up with a plan for how to change schools. And her vision of what high school should look, she still loves to play. She loves dolls. She loves toys. I think she is better than the rest of us because she has kept her imagination alive and well all these years. It's really beautiful. And her vision of a high school is that they have more than 20 minutes for lunch and that they go outside and all throughout the day, and that there's time for play and there's time for imagination and creativity and for her to act like a kid. And, I just think that vision makes so much sense to me, not as an accommodation for this one person. And I think that's where we get lost, right? We don't, we think that we're not being ableist when we help accommodate a child, but what if all kids could have a more playful life that she's describing? Wouldn't we be all better off, right? Like what we think of as typical or as achievements, maybe we're missing like a lot of amazing things and achieve, like if we could change what we're celebrating, we might realize how much more is there.
I love that you really shared this dream from someone that you worked with. I mean, honestly, it makes me think about a dream for what our workplaces could look like if we wanted to be neurodiversity affirming. If, since the person you work with talked about this dream in school, like, there's so much more that our society can really do when we think about neurodiversity affirming approaches for so many different aspects of life. Do you have any specific tips or strategies on how we can be more neurodiversity affirming with clients that are maybe some like really key things for our learners to take away from?
I think having lots of different ways of accessing what we're doing, not just one, and it's also thinking through the simple things. Like I was in a training and he, Dr. Robert Grant, he's the creator of All Play Therapy. I was in a training with him and he was talking about being neurodiversity affirming. And one of the things he said is having multiple access points to therapy, meaning not just phone calls, because phone calls are very uncomfortable I actually find phone calls, I much prefer text, but for neurodivergent people, it can be particularly uncomfortable. So we like the simplest things like that, right? Having an email option or a text option, a phone option, and an in-person, like thinking through on every level of someone first reaching out to you, then coming in my waiting room, we have multiple kinds of seating, right? So that whoever wants to sit or stand or be can feel like there's a space for them. We keep noise canceling headphones. We keep all kinds of tools that are easily accessible to everyone in our space. And I think that's something that could be, in many ways replicated, not just in a therapy environment, but in any environment. We want to be thinking about how people access us, what their experience looks like when they get to us, and all of the ways they communicate with us in that process.
No, thanks. Thank you for that. And I heard this idea of looking at different communication modalities, this idea of even thinking about different ways of waiting in the weight room, different things from the start of contact with your office to getting into the session to ending the session. And so really thinking about the entire experience and considering how ableism manifests and whether or not it's neurodiversity affirming is really important. And so, actually a lot of folks in the chat have a lot of questions. So, we are now going to begin answering some of those questions submitted during today's conversation. And as a reminder, you can still submit questions throughout the chat box. And for those who are interested, here's also Emma's contact information. So let me take a look at what questions have been posed. All right. So can you explain the difference between neurodiversity and what it means for a person to be neurodivergent? So this is actually a pretty common question. So
yeah, you'll often hear people use the term, they'll say a neurodiverse person or child, and that's actually not how we want to say it. And I've definitely done that in my learning process. Neurodiverse is the idea of this diversity of brains. Neurodivergent is the brain that is not typical. That is an autistic brain, that is an ADHD brain, dyslexic brain. So when we're talking about a neurodivergent person, we want to make sure we're saying neurodivergent person, not neurodiverse person. And when we're talking about creating neurodiversity affirming communities, that's a larger concept about diversity acceptance.
Thank you. And I hope that helps answer the questions for those who were wondering. Another question we have was about communicating to children. So how do you communicate to children and adolescents that the play is not only play and addressing challenges that the clients face?
It depends on the age and stage of the child, but there is no such thing as just play. I think that's important to remember. Mr. Rogers famously said that play is the work of childhood. So, you know, oftentimes it's actually explaining that to the parents as opposed to the child, because they are doing the work in play. They don't need to think it's anything else. And we explain to the parent the power of learning through play. There are studies that say children learn things through playing something out 2 or 3 times, that it would take them like 50 times to learn by studying the same thing. You know, if they're older and they have their own goals they're trying to reach, we might do a more directive approach where we talk about what we're working towards. But sometimes, you know, in our own experiences in therapy, we're not necessarily sitting there with our therapist saying, you know, this is what we're focused on and this is what you're going to get from it. You're just having the catharsis of release, and that's enough. And so we also have tools that we use in our play back to the child, where they might be gaining skills without necessarily knowing it's happening. And we really do a mix of directive and non-directive, depending on the child and their need. But in general, play is great work.
Thanks for that. You know, so everyone, please play, play, play. All right, that's such a big message. And another question, so children, adolescents, and families are coming to you because they need help, that they are facing challenges. Can you talk about how your introductory sessions differ from more traditional therapy for children and adolescents?
Absolutely. So, you know, when I first started in this field, my introductory sessions look like parents and a child sitting in a room and sort of collecting information and assessment and those kinds of things. Now it looks more like having a meeting with the parents, collecting information, giving them some psychoeducation, supporting them. And the child, a lot of times we'll just have a child walk in. Depending on their need, we might start in a smaller office because the big room might be too much, or it might be just what they need. And we just really let them lead in the beginning and explore the toys and explore the play and explore the swing. And, you know, I can just think of a couple of amazing kids we've worked with here who walked in terrified. Maybe we're here 5 minutes the first few times they came. And then we're here for 10 minutes, and then we're here for 20 minutes. And then a year later, we're kicking their shoes off when they walked in, like they lived here and own the place. So we really meet them where they are. We don't push more than they're able to do in the beginning. The goal is just to have them, you know, you want them to want to be here. Otherwise, you know, the same as anybody in therapy, if they're not buying into it, they're not going to do it. So that's sort of what our intake process looks like. And we meet with parents pretty much monthly to go over what the work we're doing with the child so that they can incorporate it. You know, it's can't be done without that. And the parents are able to sort of understand what their child's getting here, and then, you know, put the work in at home that complements it.
Thank you for sharing that. And, you know, everyone in the chat box, if you also have practices during intake processes that sound similar or are neurodiversity affirming, please feel free to share it with us. You know, this is a really, really helpful thing from Emma. So I would love to also hear from you all if you have any of those types of ideas. So another question, I thought we did not say autistic person. We would say person who has autism. I know you addressed some of those aspects. I don't know if you can directly address that a little further.
Yeah, for sure. It's complicated, right? When I went to school, if you said autistic person, you were corrected. That was not correct. We were saying that a person is their autism and we don't want to do that, right? But actually, now if you look at ASAN, the Autistic Self-Advocacy Network, or if you turn to other, groups created by neurodivergent and autistic people, you'll see that this is the movement that they are making for themselves. And that's who we want to be listening to. I'm still careful when I work with a family to learn what terminology they're using and to try my best to understand why and work within it, and also teach them what I've learned. Because we don't want to say there's a right and a wrong way, but we also want to speak of people in the way that feels respectful to who they are, how they identify, and how they see themselves.
Thank you for that. Another question is about ableism, and if you could share a bit more about ableism through this kind of lens of white supremacy and disability justice, that person feels like that's what's missing in this context and perspective.
Yeah, I mean, I think I could lead a whole nother one of these workshops on that. And I think there's such an intersectionality of all these different pieces, right? If you really study some of the ways that race and gender and neurodivergency go together, Black children are statistically not being diagnosed till 2 years later than white children. There's really important things going on in the way that we label different children and the expectations that we have. I think that this, feeling towards disabled people is not new, and it all fits into sort of the larger picture of the patriarchy and the world that we live in, which is, why I say when we think about ableism, it's like all the isms. We have to understand our role in all isms to be able to properly work with people who are hurt by all those isms. And this specifically is just, and I think that it's a really important question, because can you really talk about one ism without the other? And I think they intrinsically do go together. Sexuality as well. There's so many pieces to how ableism affects all of us, but specifically marginalized communities.
I appreciate even the first line about how this is like a whole webinar that we could do in and of itself. And please, everyone, when you fill out the feedback forms, there's going to be a section where you can ask for follow-ups, further types of webinars, and we would love to hear what you're looking for, because it is important, especially as we think about the intersection between ableism and all those other isms, and really think about disability justice and then social justice overall. So thank you to whoever was raising that question.
Just a short follow-up to that
Yeah.
also, gender and neurodivergence is a really interesting thing too. We're now finally in a place where we're thinking more about autism in girls. We really think about autism as the stereotypical young white boy, and that is not everyone's autism. And I've been really seeing that with girls and women I work with, especially the women I work with, or people who identify as women, that are saying, I'm realizing I've been this way my whole life, but I had to mask or cover who I was because it was so misunderstood. They were just told, you're anxious, you're depressed. And they're like, there's more going on here. So I think it crosses so many different realms that we live within, and we have to really be thoughtful about our stereotypes around neurodivergence.
No, thank you for really adding that. And I see some folks in the chat are really resonating with this, and the fact that it could be a whole other session, a whole other course,
Yes.
a whole other field. There's so much to really think about how this all intersects with one another. You said that people sometimes realize they've been living under an ableist kind of society, a world that really centers neurotypical folks. Someone asked a question about trauma. Do you include trauma survivors when you think about neurodivergence?
Yeah, I think it's an interesting thing. I think we're going to talk about the 8 senses when we have our seminar, and one of them is called interoception, and I'm going to get more into that there. But this idea of understanding the feelings we have internally and how those play on us in the way that we live, whether that's hunger or tiredness or other things. And trauma can really trigger responses in the body that later make it harder for us sensory wise to understand our body and the way it's processing sensory stimuli. So I think there's a lot of crossover. And then again, you have the crossover of children who were born neurodivergent and go through trauma, and then separating out the different pieces of what's happening in their bodies can be very, very challenging, but also very important.
No, thanks for really differentiating that, because it's so complex when we think about the social context that we live in, and then like what's happening internally with the individual. It is so much. And I see some people in the chat box actually saying like, hey, there's not enough who understand everything that you're talking about, not enough people who have the knowledge of what you're talking about growing up in their educational systems. Can you maybe talk then about are all the approaches you've talked about, is that even accepted by the general mental health community?
It's a really tough question. I think it depends which community and where. I think, for me, one of my great challenges is working within school districts and getting them excited and on board for this, and in the medical model as well, working with doctors and people who have done things a certain way for a very long time. The way that I keep myself inspired to do this work, so I don't get discouraged, is I sort of think about it the way I talked about the parents earlier, in the sense of maybe they're not there yet. I don't know how long the road is going to be to get there. There are definitely some that are not going to, as with all the isms and things we, fight for as social workers or therapists or, just justice warriors. But I'm hopeful that the ones who want to learn, even if they're really, really early on in that journey, can. And I think that I try to find the levers for change within the systems that I work within. And that's why I've moved, I'm still practicing, but I'm trying to get this information out to as many people as I can. I want more practitioners to know, more educators, more medical professionals, because the more of us that are doing it and talking about it, the more it will hopefully catch on and people will see the benefits of it.
I know I appreciate you really just saying like, I need to stay motivated. I need to keep the hope up. And it is something that you can't do alone, right? And, I see that there are folks in the chat box who are trying to advocate for similar ways of practicing and thinking about how to truly live and practice in a way that can honor neurodiversity and to be anti-ableist. So even further thinking about neurodiversity, sometimes it becomes really challenging for folks to wrap their heads around what is something that is acceptable versus unhealthy. And so this question is from someone who says, is there a dividing line between accepting neurodiversity and being affirming versus what is not acceptable, what is not healthy? Like that must be a big challenge for folks who are learning about this for the first time, especially.
Yeah. And I'll talk about this a little bit in the seminar as well, but the term I like to use with families is loving limits, right? So we don't say, okay, you can do everything that you want, right? That's not the world we live in. And that's actually, neurodivergent children and all children thrive off of consistency and structure, not a free for all. So it's a balance, right? And I'll talk about things like storyboards and having, visual schedules and things like that to create that sense of security and that understanding of when we're doing what we're doing. And, there are times when a behavior is unhealthy and we need to explain and work through that. In play therapy, in child-centered play therapy and all play therapy, what they teach us is you don't set a limit until it needs to be there. So the idea is we do set limits, we do explain why, but we don't make them arbitrary and universal. So as we understand what our children need, we set those, and we want to live lives that are very structured so that when we leave that structure, we can more easily come back to it. More structure actually makes us to be able to be a little bit flexible. And a lot of front loading and planning and explaining and having, your children understand what they're going to be doing so that they know, what's coming. And so there's less anxiety. And I'll talk a lot more about that. But yeah, it's definitely not limitless. The goal is to create, opportunities for regulation and connection in healthy ways.
There's just so much that you said there. And I think this means that everyone should be going to the next month's event, if you can. And just looking at the time, we just have time for just one more question. And just you can keep this one brief because I think you answered most of it. But is there anything different between working with a 6-year-old versus a 16-year-old when you do an intake? Any special considerations that would be helpful for them to walk away with?
One thing we try to be really conscious of is not just understanding a person's age, but where they are developmentally. So, having 2 6-year-olds could look very, very different. I think it's about understanding the child that's walking in and what their unique strengths and challenges are. We ask those questions before we meet with them, so that we have tools that look familiar to them. And things that make them more comfortable when they walk in. But I think of it, yes, I mean, you're not going to do the same thing with a teenager that you're going to do with a small child. But as a mother of twins, I can tell you each of my children would need a very different experience coming into a room. So, and have very, very different interests. So I think the goal is really that's why so much of it is self-led. In the very beginning, because we want to create opportunities to learn what the person walking in gravitates to, and then work within that, as opposed to steer them towards what we think they should be gravitating towards. But it's just, yeah, I mean, I think so much of what makes this work more challenging is you can only plan so much. And a lot of it is just going with what comes and learning to sort of flow with it as you go.
Thank you for that wisdom. Some people have been asking about how they can be connected with the next event. So the next one is on April 24th at 1:30 p.m. It is everyone who registered for today has been auto-registered for that. It will be a continuing education eligible kind of event and also has a cap of 300. So many of you may have received emails already saying that you have been waitlisted, but hopefully we're able to have you join us next time, where we talk more about how sensory integration meets emotion regulation, and Emma can go more in depth into how to really truly support people. We have also this Thursday, we have an offering from a telehealth team to telehealth or not to telehealth at 1 p.m. And finally, we have a panel event on Tuesday, April 18th at 11:30 a.m. regarding how ACEs awareness can break cycles of intergenerational trauma. And so please visit our website for the full list. And that will be at ctechny.org, which will have helpful information, including a recording and slides to this presentation, plus a tip sheet, which we'll be developing, and all that will be posted in a few weeks. Kiara just added a link in the chat box so you can complete our brief feedback survey. And you're also going to get that link once you leave this webinar as well, in case you're unable to complete it. On behalf of CTAC and Emma, thank you for joining us and have a great rest of your day. If you have any questions, contact us at ctac.info@nyu.edu. Thank you again, Emma, and thank you, everyone.